what's really important to highlight, thyroid embolization is a great modality, but it's not to replace thyroid ablation. It can be used in conjunction with the thyroid ablation. So let me explain more. I explain to patients the following, that I think of the thyroid and the thyroid nodule as, okay. That's what I tell my patients. I think of the thyroid and the thyroid nodule as an avocado, and you have a nucleus inside the avocado. The thyroid embolization cut the blood supply to the thyroid, so it only can maybe shrink the entire lobe, but it's not targeting the nodule. You cannot target the nodule by embolizing the entire gland. It's not going to work. Specifically, if you have, for example, cancer, what you need to do is to target the nucleus, target the nodule. So localized treatment by the ablation is the answer to this. Having said that, maybe a combined therapy in certain cases can be very helpful. And we are looking into this. We have also a great experience with embolization. But embolization is a little bit more invasive technique. It takes a while to do it. And there is possible risks, but I guess it needs to be done by an experienced person who does this all the time. But more importantly, most patients do not need it. And unfortunately, it's offered for patients who are not going to benefit from it. But I think combined approach can benefit. The only indication that I can think of that it might be beneficial without the need for ablation, when you just have a diffuse goiter that's not nodular, you're not treating a nodule. There is some data that it can have maybe a 50% success rate in Graves' disease, and we do not treat this with ablation. So that's a completely different story. And there is a significantly higher risk of complications reported with embolization compared to the ablation. Also, if you look at the published data, there are thousands and thousands of cases published in the literature with the ablation technique versus just really significantly lower numbers with the embolization. But I don't understand how can you, I don't get it when patients are offered embolization for a nodule that's intrathyroidal, for example, and it's not large, etc. Does not make any sense to me. Because you're only going to shrink the entire lobe. You're not focusing on treating the nodule. So when we treat the nodule, we can kill the cells and it can disappear with the ablation. Or, for example, cancer cells might not be present even with a repeat biopsy. This is not going to be the case with the embolization. I can literally surgically tie the blood supply of the thyroid in one side, and the thyroid will continue to be functional because the thyroid is extremely vascular gland and it can get blood supply maybe from the contralateral side. You know, when you do surgical resection of the thyroid and you leave a remnant thyroid tissue and you do not remove all the thyroid, small remnant tissue can, in some cases, grow over the years to be a huge goiter because the thyroid is very vascular, can easily grow. So embolization is not going to work for most cases. It only can work in a select group of patients, and this really has to be looked at very carefully. So patients really have to counsel someone who can offer both techniques.